Sir Jun Reyes. Maganda ang ating pag-uusapan ngayon. Ang pag-uusapan natin, it's about mga 5 questions na binasa ko isa-isa. Yung mga pasyenteng o mga viewers na nagtatanong, ano yung 5 pinaka-common na tinatanong? Yan, magaganda pong topic natin ngayon. Sana nag-enjoy kayo ng ginagawa nyo dyan at healthy kayo dyan. At patuloy kayong bine-bless ng God, ng ating Panginoon sa mga ginagawa nyo. Natutuwa din po ako, may tumawag sa akin na 83 years old. Alam nyo, tuwang-tuwa siya. Pinalo niya yung daily exercise, best daily exercises sa mga seniors. So, continue doing that. Make it a habit. Yung lifestyle nyo na gawin nyo yung exercises every day. And all of you watching, may God bless you all the time. Make sure you're healthy, keep healthy, your family, lahat po na nanonood dyan. Okay, mag-umpisa na po tayo. Yung mga 5, again, this is Dr. Jun Reyes, your physical therapist. Yung mga 5 questions na ginagawa natin. Number 1, may tanong dito si Mr. De La Cruz. Actually, Mark De La Cruz, ang tanong niya, ano ba yung masakit na dito sa thumb area? Lagi daw masakit kasi ano siya, chef siya and naghihiwa siya lagi ng karne, ng prutas, ng vegetables. So masakit lagi yung thumb area niya. Ito, area na ito. Ito po ang tinatawag nating tendinitis or Quervains Tenosynovitis. Napakasakit po ito. Ito po ang isa sa pinakamasakit na pain, pinakamasakit na joint or tendon, na tendinitis, pagka na-experience nyo. Yan, napaka-sensitive po niya, napakasakit po. Paano natin malalaman kung may Quervains Tenosynovitis tayo? Ang tinatawag nito sa physical therapist, I'm a physical therapist, how do we know ang Quervains Tenosynovitis? We have a test, a special test, we call the Finkelstein Test. Ang Finkelstein Test, ilalagay nyo lang yung thumb nyo dito sa inside ng kamay nyo and then i-squeeze nyo going ulnar deviation. Pagka masakit siya dito, positive for Quervains Tenosynovitis. Napakasakit po nitong Quervains Tenosynovitis na yan. Now, ang tanong niya, paano ba natin pagagalingin ang tendinitis? Matagal ito, pero pagka finalo nyo itong mga step by step na gagawin ko sa inyo, na ituturo ko na pwede nyo gawin sa bahay, mapapabilis po ang paggaling nito. Okay? Number 1, kung sobrang sakit po talaga, you can use ice. Mag-umpisa kayo ng ice, tapos i-avoid nyo yung mga yung madaming movements na ganyan or cellphone or gaming, or i-modify nyo yung paghiwa nyo ng vegetables o ng karne. So if you can modify it by not squeezing too hard, so you can just maintain your movement just like this. You can just cut. Make sure you're not pressing too hard, you're not squeezing it. So you can hold it with your 4 fingers, and then you can just cut the vegetables or your meat. You can modify your movements, okay? Or you can make the handle bigger. Yung knife, make it bigger. Mas makakapal yung handle ng knife. And then you can cut or do the same movements. Modify the movements and then after icing it. Now, after pagka medyo magaling na yung tendinitis, yung Quervains tendonitis, ang Quervains po, itong tendon na ito, nandito. Ang affected na tendon is your extensor pollicis brevis. Yeah, medyo mataas siya dito, masakit dito. And then your abductor pollicis longus. Yan po ang nagkakaroon ng inflammation or swelling. Napakasakit po nito. Now, meron po tayong Dr. Reyes Liniment Cream. Very effective. May tumatawag po sa akin lagi na it's 100% effective para sa kanila. Actually, ginagawa na nga nilang pabango. They called me, they said, Dr. Reyes, I smell like you every day. You know what? Itong Dr. Reyes liniment cream, ginagamit ko po everyday. Parang nagiging pabango ko na. I'm using this everyday. Alam niyo yung cold ko, ginamit ko siya sa chest area and then all the way to the posterior neck. Gumaling po agad ako. So I highly recommend para sa mga giveaway nyo sa mga kaibigan nyo. Kung may pamilya kayo nasa Amerika or kaibigan kayo, magpabili kayo dito sa New York. Okay. Now, paano ba imamassage? Gagamitin ko ang Dr. Reyes liniment cream. Okay. Just like that. Konti lang naman ang gagamitin nyo. And then the thumb area, imamassage siya dito. Yan. Dito. Ang gagawin nyo, transverse massage. Transverse friction massage. Okay? So, gagawin natin, opposite the muscle fibers. Ganyan. So, idadaan nyo lang yung thumb nyo, going this way. Opposite from medial to lateral. Just like this. Watch nyo, ha? Ito yung thumb. Ayan. Yun. Ganyan. So, all the way, isama nyo na rin itong extensor muscles natin. All the way right here. Yan, i-massage na rin. Kasi yung tendon, yung muscles yan, nagiging tendon pataas. Napakasakit po niyan, okay? Yan po, i-massage nyo lang. Panigurado, gagaling po siya agad. Make sure ang pressure nyo, ang tanong dyan, gentle to medium pressure po ang gagamitin, ha? Huwag pong masyadong madiin. Kasi ang purpose nyo lang, ang goal nyo is to increase the blood flow. Just like that, i-massage natin. All the way dito sa forearm muscles. Just like that. Transverse friction massage. Now, ilang minuto po gagawin? Mga 2 to 3 minutes po ang massage. 2 to 3 minutes ang gagawin po natin. 2 to 3 minutes, okay? Now, we're gonna do friction massage. You can do circular motion just like this. Concentrate lang, 2 to 3 minutes. Okay, 2 to 3 minutes dyan po sa area. Huwag masyadong madiin. And then all the way to the IP joint. Just like that. And then all the way to the forearm muscles. Just like that. Okay, again, gamit tayo ng Dr. Reyes liniment cream. Alright, pakita ko sa inyo. Yan. Yan, para. Yan. Ganyan, ha? Ganyan po. Alright. And then all the way to the forearm muscles, just like that. Okay. Now, after ng deep friction massage, again, gentle to medium pressure, ang gagawin nyo, magsi-circumduction movement. Ano ba yung circumduction movement? Pagka sinabing circumduction movement, ibig sabihin, paikot siya. Alright? Gentle motion. So, igagalaw nyo lang yung thumb area, gentle motion, mga 3 sets of 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and then 10. Alright, one more time. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Last one. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay? Alright. Now, after ng circumduction, kasi yung muscles natin, umaabot 2-jointed po yan dito sa thumb area and all the way to the wrist area. So, huwag niyong kakalimutan na i-stretch din. Active range of motion tayo. Flexor and then extension. Alright? Alright. Ang gagawin natin, extension muna, over pressure. Just hold it for 5 seconds. And then you go extension. Hold it for 5 seconds. Alright, and then back 5 seconds, and you do this 10 repetitions. Yan. Yan po ang ating ginagawa sa Quervains Tenosynovitis or Tenosynovitis. Okay, just like that. And then back. Alright, and huli, last one is i-massage natin ang thenar muscles natin. Kasi kung tight ito, laging ipinupul yung tendon natin pababa. Kasi overwork yan overuse syndrome, lagi tayo nagaganyan, no? So, i-massage na rin natin ang thenar muscles. Ang technique na ginagawa ko is scooping massage. Yung 4 fingers going to the thenar muscles. You see? Just like that. Ayan ha, libreng karunungan. Libreng payo. Libre sa atin lang to ha. De, biro lang. You can share this. Ayan. So, just do kneading massage. Yan, mga 30 seconds lang po ito. Ayan, ganyan. Alright. So, yan po ang Quervains or painful thumb exercises and massage. Number 1 na katanungan po yan ni Mr. De La Cruz. Number 2, may nagtanong si Maria. Alright, si Maria. Ang tanong niya, na-stroke po siya. So, nangyari, na-stroke siya, masakit lagi yung shoulder niya. Kasi, anong nangyari, nakaganyan siya. Ang stroke niya is, I think it's been 8 months na. Sabi niya, 8, almost a year. So, nakaganyan na siya, napabayaan niya, hindi siya nagpa-PT. So, nanigas na yung kamay niya. So, anong nangyari? Nagkakaroon tayo ng subluxation. So, sobrang sakit po nito. Pag nagkaroon ng stroke, nagkakaroon ng subluxation of the shoulder. So, ito po yung naapektuhan, nakababa. Makikita niyo yung mga na-stroke. So, ano ang dapat gawin natin as a caregiver or as a physical therapist or yung nag-aalaga sa ating mga family member na na-stroke? So, nakaganito, no? So, unang yung gagawin, ituturo nyo sa pasyente, ilagay yung kamay na ganyan, alright, and then stretch nyo lang na paikot, iikot lang, yan, extend yung elbow, yan, para hindi laging nakatigas na ganyan. Ulit, papakita ko sa inyo, dahan-dahan ha, para matutunan nyo, pagka nakaganyan ang kamay, ilagay ang kamay, ituro nyo sa pasyente, gawin nyo ito exercise every day. I-turn na ganyan, tapos extend. Alright? So, make sure you encourage your family member. Your family members, ituro nyo ito, papanoorin nyo sila ng Dr. Jun Reyes, PT, DPT. Okay? Alright, so nakaganyan ang kamay, ikot natin. Ayan. Tapos extend natin yung wrist. Extend natin yung elbow. Yun. Yung mga nagsasend ng stars, thank you very much. Thank you po sa mga nagsasend ng stars. Thank you for supporting Dr. Jun Reyes, PT, DPT. Okay? Now, pagkatapos yan, itataas naman natin. Kung hanggang dito lang ang kaya, okay lang yan. I-stay lang natin na ganyan. I-maintain lang natin ang range of motion. Okay? So, again. So, pakita ko sa inyo, nakaganon. Extend, ganyan. And then stretch natin lang ganyan, yan. And then all the way up, yan. And hold it for 5 seconds. Bring it down. Alright, again, nakaganon. Ilagay ang kamay, extend your wrist, extend your elbow, all the way up. Yan, madami po tayong matutulungan na kababayan natin, lolo't lola, mga OFW, ganyan. Marami pong salamat sa nagsasend ng stars. I really appreciate you. Merry Christmas sa inyong lahat. Alright, again, stretch all the way up and then hold it for 5 seconds. You do that for 10 repetitions. Okay? Alam nyo, natutuwa ako sa inyo. Kahit na tawag dito, simple lang tayo. Alam niyo, I really appreciate yung mga nagsasend ng stars dyan. I'm seeing they're sending stars all the time. Thank you so much. Talagang sinusuportahan nyo ang ating kawang-gawa, ang ating advocacy. Thank you. Thank you so much. Alright, so may subluxation. Now, kung matigas siya, nakaganon pa rin, ano? Gawin nyo lang araw-araw, panigurado mag-i-improve po yan. Now, ngayon, kung matigas siya, pwede nyong mag-PNF kayo. Yung PNF motion, mga functional movements po yan. Pag nakaganon, ang PNF natin, mag-start tayo ng ganito. Pa-cross naman, igaganon natin. Yan. I-move natin yung arm away. Pag ganyan, ano? ganitong movements. Away. So, opposite again. Ibubuka natin yung shoulder. Tapos yung wrist natin naka-extend na ganyan. Alright? I-assist ko. Ang mag-a-assist itong opposite shoulder. Okay? Alright. So, you're moving yung arm. Tapos, extend ang wrist all the way up. I-move nyo lang ng ganon. Alright? Mahirap tong gawin nila. Pwede nyong i-assist ang inyong lolo't lola or ang inyong pasyente. Ulitin natin. Ang kamay na kaganyan, i-move natin ang kamay na ganito. Ganyan. Okay? Let's do this 2 more times. Alright. And last one. And then just like that. Okay. Alright. Yan po yung pangalawang tanong. Yung may shoulder, yung mga na-stroke. Kasi lagi, usually, mga more than 50% ng pasyenteng may stroke, bumabagsak yung balikat, napakasakit po nito, kailangan maagapan nyo. Pagka hindi nyo naagapan, lalo pong sasakit. So, tandaan nyo po lagi, pagka na-stroke po ang pasyente, ang chance na bumagsak ang shoulder, mataas po, at lalong masakit kasi lagi nakaganon. Make sure agapan ang pagtitreat, yung pinakita ko sa inyong techniques, napaka-effective po niyan. So, siguraduhin yung gagawin nyo at ipapakita nyo ang mga videos natin para gumaling sila. Alright, number 3. So, after the stroke, may nagtanong naman si Lito. Ayan, ang sabi ni Sir Lito, Dr. Reyes, maraming pong salamat. Lagi ko po kayong fina-follow sa Facebook at sa YouTube channel nyo. Nagpapasalamat po ako sa inyo at ginagawa nyo ito ng libre. Ayan, yan po ang sabi ni Mr. Lito. Ayan. Ang problema niya, may shoulder pain siya. Hindi niya malaman kung ito ba'y tendonitis or a complete tear, rotator cuff tear, or frozen shoulder. Okay. So, ang lagi niyo tatandaan, ang shoulder pain, madami pong dahilan ito. It can be arthritis. Meron tayong arthritis of the shoulder, or meron tayong tendonitis or rotator cuff partial tear and frozen shoulder. Now, ang pag-uusapan natin, ang shoulder pain po, paano natin ma-identify kung tendonitis to or a partial or a tear or a complete tear. Pag sinabi pong tendonitis, we have a test we call the empty can test. Alright? So, empty can test, ibig sabihin, tinatapon ko yung soda. Yan. Kaya tinawag na empty can test. Alright? Let's adjust this. Okay. Pakita ko sa inyo. Ang empty can test, you put your thumb down and then i-resist nyo. Pagka masakit siya, ibig sabihin, you have a tendonitis or a rotator cuff tendonitis or tendonitis. It means you have tendonitis. It could be a partial tear too. Alright? So, pagka bumagsak siya, ayan, may tear po yung rotator cuff tendon. Pagka na-maintain nyo naman, it could be a combination. It could be a tendonitis. Pagka hindi maigalaw, it's a full thickness tear or hindi niya maigalaw na ganyan, but complete range of motion, that's a full thickness tear. Okay, another test, yung itinataas and then masakit all the way up. Yan po yung impingement sign test. Masakit po siya. So, ibig sabihin, nagkakaroon ng it's what we call impingement syndrome. So, ang gagawin natin na treatment para sa tendonitis, kailangan malaman natin kung may tear or complete tear or tendonitis, yung empty can test. Ibig sabihin, na-hold niya pero masakit, it could be a tendonitis. Pagka na-hold niya and then hindi niya nakaya, it could be a partial tear. And then, pagka hindi niya maigalaw, it's a complete tear. Alright, paano natin tinitreat ang tendonitis? If you have a shoulder tendonitis or bicipital tendonitis or supraspinatus tendonitis, i-maintain nyo yung range of motion. Range of motion and then soft tissue work. Alright? So, range of motion first. Gagamit tayo ng, again, you can use a stick. Let me get a cane. Okay. Gagamit kayo ng cane. Pagka may tendinitis kayo and you can't move the arm up, use the cane. You can put your hand like this and then you stretch the arm up just like that. Stretch, hold it for 5 seconds and then all the way up. Even na medyo kung masakit siya, push it a little bit. Wag sobrang sakit. Just bring it down. Alright? Hold it for 5 seconds. Let's do this one more time. Ipakita ko sa inyo. Yan. Pagka may tendinitis po, make sure you get that range of motion kasi baka mag-lead ng frozen shoulder. Now, gagawin natin naman shoulder abduction. So kanina, flexion, ganito po ha. Gawin nyo 10 repetitions. Now you're gonna go the opposite side. Right there. Opposite side. Just like that. I mean, abduction, shoulder abduction, pabuka, away from your body. Shoulder abduction, just like that. Okay, pakita ko sa inyo nakatayo. Alright, shoulder abduction. Pakita ko ha. Shoulder abduction, just like this. Alright, hold it for 5 seconds. You do that for 10 repetitions. Just like that, 10 repetitions. Alright, hold it for 5 seconds. Okay, good. Tapos yung shoulder external rotation, i-add nyo ito. Just like this. Alright. Like this. Alright. Hold it for 5 seconds. And then back. Hold it for 5 seconds. Back. 5 seconds back. And just do that for 10 repetitions. Okay. Now, pagka frozen shoulder, ganun din po ang pwede nyo rin gawin, ang frozen shoulder, pero napakasakit po nito. I-massage nyo naman yung shoulder nyo. I-massage nyo dito. Pagka frozen shoulder naman, make sure you work on that armpit area. Okay? Pagka shoulder tendinitis, i-work nyo yung, let me take this out. Yeah. Right there. Okay. Pagka may tendinitis kayo, ang i-work nyo itong supraspinatus tendon. I-massage nyo, gamitin nyo yung Dr. Reyes liniment cream. I-massage nyo dito sa supraspinatus area, just all the way right here. And then, circular motion, maybe 2 to 3 minutes. Isama nyo na rin yung biceps area. Yung biceps area or bicipital area, just the front of your shoulder. Yan, napakasarap niyan. And then the infraspinatus muscles right here, and then your supraspinatus right here. Ayan, napakasarap nito. Ayan, again, 4 fingers, scooping motion. You can do scooping motion going this way, right? That's your shoulder. Ganyan. So, scooping motion. At panigurado, pag sinunod nyo ito, yung mga may shoulder pain dyan, 2 to 3 minutes. Kasi minsan, 30 seconds, pagod na tayo. So, break it down, but make sure you do it for 2 to 3 minutes. Scooping motion, just like that. Just like that. And then, natural exercise, rotation, just like this. Napaka mabisa ito sa ating shoulder joint, lalo na kung minamanipulate natin ang ating shoulders. Alright? Another one is your pendulum. In that traction, you can use the weight. Maybe, for example, this. For example, I'm holding a can of soup or 1 to 2 pounds. You can just do pendulum exercise, just like that. Pendulum, and then you can do rotation. Okay? Whether you have a tendinitis or a frozen shoulder, you can do this. Alright, good. Now, frozen shoulder massage, I like to massage yung armpit. So you can do your subscapularis right here. Just right here. And then go, not too hard, medium pressure. Igalaw nyo lang siya, ipit nyo siya, and then dig in. Yan, napakasarap nito. Napaka-effective. Ididig inyo, ipapasok nyo dito. igagalaw nyo right here. Yan. And then you can do pressure. Imamanipulate nyo yung muscles nyo going this way. Effective po siya sa mga frozen shoulder. And then make sure you stretch it. Okay. Ayan, nasagot ko na yung pangatlo at pang-apat kasi yung pang-apat it's about frozen shoulder. Ang huling katanungan ni Miss Melissa Lopez. Ayan. Kay Miss Melissa, thank you sa mga nag-send ng stars. I really appreciate it. Nakikita ko po kayo kung sino man po yung nagsasend po dyan. I really appreciate it. Eto, magandang tanong to kay Miss Melissa Lopez. Ang tanong niya, lagi siyang nahihilo. Nagkaroon siya ng inner ear infection. Dr. Jun, may tatanong lang po ako sa inyo. Ako po'y laging nahihilo every time na yumuyuko ako o humihiga. Parang ang room ay spinning. It could be two things, no? Meron siyang benign paroxysmal. Melissa, this is for you. Meron siyang benign paroxysmal positional vertigo. It means meron tayong crystals that displace in one of the canals. We have 3 canals in each ears, okay? So bale tatlo dito, tatlo rin dito, so 6 siya. Pagka may weakness tayo doon sa mga crystals na yan, dito sa inner ear natin, as we get older, we still don't know why we get benign paroxysmal positional vertigo, but very common to sa mga pasyenteng may diabetes, older adults, and somehow may rheumatoid arthritis too, common din siya. Pero pagka nagkaroon siya ng crystals that displace in one of the canals, nahihilo po siya, when they bend over or when they lay on their right side or left side. So ang ginagawa ko po dito, yung Dick-Solpike testing. So in Dick-Solpike testing, ma-identify natin kung anong ear, kung ano yung ear na apektuhan. Tingnan nyo po sa YouTube channel ko kung paano yung Epley's maneuver. Pero napakamahal po ang testing. You see a neurologist. Napakamahal po ng test dyan sa atin sa Pilipinas. Consultation pa lang, mahal na. Especially yung mga specialist or ear, nose, throat doctor, ENT doctor. So, ito, para ma-save po kayo, makalibre kayo ng consultation fee. Kung hindi naman ganun kalala, kung sa tingin nyo, but make sure you see your medical doctor, okay? So, you can follow my instruction. Paano natin malalaman kung sa inner ear po siya? So, make sure you follow a Dick-Solpike testing, and then we can do an Epley's maneuver. Usually, it can cure the problem. Now, kung nahihilo pa rin and inner ear infection naman siya, Melissa, I think you have a benign paroxysmal positional vertigo. You can try the Epley's maneuver, Epley's maneuver. Go to my YouTube channel. There's an Epley's maneuver. Now, if you have an inner ear infection, tapos lagi kayo nahihilo, again, my liniment cream, highly effective. Ginagamit ko po sa Reyes Physical Therapy. Merong mga dahilan na nahihilo ang pasyente. It could be coming from the neck. That's what we call cervicogenic dizziness. Or if you have an inner ear infection like vestibular neuritis or vestibular labyrinthitis or vestibular neuritis, it depends, but worse yung labyrinthitis. But vestibular neuritis, very common po ito pagka nagkaroon ng inner ear infection. Pero pagka nahihilo secondary sa neck pain, gamitin nyo yung Dr. Reyes liniment cream, or you can use an oil, ginger, coconut oil, and ginger combined. That's good too. All right. So you massage all the way to the behind the ears, yan, and then all the way to the temporal area, and then to the base of the skull. And make sure you do your chin tucks, just like this, chin tucks combined with the massage. Like 2 to 3 minutes, and then chin tucks again. Chin tucks, yan. And then you can do stretching exercise, active range of motion, or actually stretching exercise, moving the hands together. All right, range of motion, just like that. And then extension, and then chin tucks. massage the posterior neck area, and then all the way to the chest area right here, posterior neck area, and then to the chest area, and then open up your chest right here. Yan, napakasarap yan. Ayan, pwede nyo ako i-follow ha, follow nyo lang ako. Alright, okay, pagka inner ear infection naman, make sure dahan-dahan nyo itong gawin. Madali lang po ito exercise nito. Itong thumb area na ito, itong thumb na ito magiging target nyo. And then you just turn your head side to side and keep your eyes on the target just like that. Alright? Medyo may hilo kayo, but that's the purpose of that. Okay? Alright. Now, another one is looking up and down and keep your eyes on the target. And let's do that for 30 seconds and then progress to a minute. Yan lang po. O yan. Ang dami ko palang nasagot ngayon. Yung mga 5 katanungan na yan. Okay, marami pong salamat sa mga nanood and thank you for sending me stars. Na-appreciate ko po kayo. And sana nag-enjoy kayo sa mga sa breakfast nyo. And keep healthy, stay healthy. And God bless you all. And I really appreciate po yung mga tumatawag na may message. At yung mga bumili po ng Dr. Reyes Liniment Cream. Ay, may nakalimutan ako. I have yung bago kong jar. Pinalitan ko siya. Inubos ko lang yung supply ko ng jar na luma. This is my old jar. Single wall siya. Kaya medyo mabilis masira. Pero ngayon, pinalitan ko siya ng mas magandang jar. This is a double wall jar. Mas, of course, mas maganda siya. And double wall, mas matibay. So, hindi siya basta-bastang masisira. Okay, so, dalawa po ang sizes natin. Ito magandang pang giveaway sa mga, lalo na Christmas. Ayan, para umabot sa inyo, orderin nyo po ngayon na para may email ko sa inyo, pang giveaway. Madaming lolo't lola natin na matutuwa. And ang mga overseas Filipino workers, ayan, pwede kayong mag-order sa akin. Just let them know kung may family members kayo sa US, they can call me, or their friends, they can call me. And then I can ship it to them. Alright, marami pong salamat. Take care and God bless you and enjoy your day. Alright, kung sa palagay nyo, madami kayo natutunan, share it to your friends. Bye-bye!